Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. On today's episode, I'm going to be talking about different over-the-counter medications, supplements, or other products that can negatively impact your menstrual cycles or fertility. I will review each of these categories and explain how these substances can impact your cycles, as well as give you ideas for alternatives when possible. So let's start off, as always, with a story about a past client of mine who we'll call Bridget. Now, Bridget came to see me because she had been trying to get pregnant for the past 7 years. As we did a full evaluation of her medications that she was taking, we also checked on her over-the-counter supplements that she was utilizing. Now, Bridget had unfortunately suffered a severe biking accident many years ago when she was a teenager, and she had chronic pain from some old bone injuries. In order to manage this pain, Bridget was taking ibuprofen, 600 milligrams, 2 to 3 times daily, and she had been doing this for the past 15 or so years. Now, when Bridget had gone to see her obstetrician, she was told that she had unexplained infertility. Part of the reason they gave her this diagnosis was that her cycles looked normal with charting. Her labs actually showed that she had no thyroid dysfunction based on what she was told, but the reality was that Bridget had ovulation dysfunction. When we did a more thorough evaluation looking into her labs that focused around ovulation, as well as a timed ultrasound to her cycle, I found that she wasn't actually ovulating consistently. Or that if she was, that the follicle that was developing around that egg was not getting large enough and sometimes was not allowing that follicle to rupture in order to release the egg. Now, there's lots of different things that can cause this, but ibuprofen can cause some big problems when it comes to ovulation dysfunction. And so I had Bridget stop the ibuprofen because we know that that can cause problems. Now, this isn't the case for all women, but it is certainly one that we know can cause some problems. Over the course of the next 5 to 6 months, we started to notice that Bridget's ovulation function was improving. Her lab values were better, her ultrasounds were getting better, and we had been able to manage that chronic pain in a way that helped her to heal her cycles and prevent other long-term consequences from being on the ibuprofen on a daily basis. So let's start with looking at a few different categories of these medications. And really what I'm going to focus on today are going to be certain things that you can get without needing a doctor's prescription. Now, this is really important because I think a lot of people feel that if they're able to get something without a doctor's prescription, that it's safe. You know, if I can pick up something off of the pharmacy shelf or if I can get something in the grocery store aisle, that it's not going to be causing me any harm. And that really is just not the case. Anything that you put into your body has potential risks as well as potential benefits. How your body interacts with that particular substance can be different from person to person. The other thing we know is that not every substance is going to be helpful in regards to fertility and ovulation or your menstrual cycles. And so this is what we're going to focus on today is a few of the main categories that we know can cause some troubles with regular cycles and thus with fertility if that's your intention. So let's start off with this first category, and these are medications that we call NSAIDs, or non-steroidal anti-inflammatory drugs. Now, this is going to include different medications you can get over the counter like ibuprofen, naproxen, and the brand names for those would be Motrin, Aleve. Notice that there are these main substances in other combination pills as well. So if you're doing anything that has any of those generic medications in it, that does also contain NSAIDs. Now, when we're talking about use of these medications, I am not talking about, I take an ibuprofen once every other week in order to try and treat a headache. What we're talking about here is that if you are taking these medications in higher dosages, more frequently and for a longer time frame. So in Bridget's case, taking it daily 3 times a day at a dose of 3 tablets of the over-the-counter strength on a regular basis can cause problems. Now, the way this works is that anti-inflammatory medicines like ibuprofen are designed to decrease inflammation. What we know about ovulation is that a little bit of inflammation is necessary. We need that ovary to allow that developing follicle to swell a little bit and to become a little bit inflamed. And so it's important to have a little bit of inflammation going on in order to induce healthy ovulation as well as follicle rupture. There have been studies done looking at ovulation and showing that when you are exposed to higher dosages of these anti-inflammatory medicines, the size of the follicle is significantly impacted, so it's much smaller, and that it can delay ovulation from happening, sometimes prevent it from happening at all. The other interesting piece with these anti-inflammatory medicines is that it can cause changes in men who use them long-term. What we know is that long-term use of these anti-inflammatory medicines can cause changes in testosterone levels, typically causing them to decrease. And this could potentially cause an impact on the development of sperm and sperm quality. So not only can it affect women, it can also affect men. The other piece from a general health standpoint is that long-term use of these types of anti-inflammatory medicines at higher doses can cause issues with chronic kidney disease, as well as GI upset or even gastrointestinal ulcers. And so for those reasons, as well as many other, it's important not to be reliant on these medications long term. So there's lots of alternates that we can utilize instead of these medications. And again, it is still okay to use them on an as-needed basis every now and again. But if you are dealing with chronic pain, ideally we want to be looking for the underlying cause of that and trying to treat that reason. Safer options from a standpoint of your ovulation health as well as your menstrual cycle health would include Tylenol or acetaminophen, trial of topical treatments, so think about things that have menthol products in them, or localized pain relief. So think about physical therapy, TENS unit, acupuncture, some of those things that can really help the pain in a different way rather than just trying to mask that pain by using those chronic pain medications. The next category of over-the-counter medications that I want to talk about are allergy medications. And specifically, I want to talk about the antihistamines. So you know these by the brand names of Zyrtec, Claritin, Allegra, or Benadryl. The other thing I will point out is that the generic for Benadryl is called diphenhydramine. And this is also in many different over-the-counter sleeping medications like ZzzQuil or Tylenol PM. So it's really important to understand the components of what you're taking and know how those can impact you in different ways. Now, one of the main concerns that I have with antihistamine medications or allergy medicines like this is that it may decrease cervical mucus. Now, we know that if you are trying to get pregnant, or even if you're just trying to track your cycles and know when you're ovulating to know if things are healthy, that these antihistamines can decrease cervical mucus. It's theorized that by drying up everything in your sinuses when you're taking them in order to help prevent allergies, it also will dry up cervical mucus. Now, this may not be the case for all women, and some women can take these medications and still have a normal mucus pattern without any troubles. But it is worth noting that if you're someone who suffers from frequent allergies, you're taking these antihistamine medications and you're not able to observe any type of cervical mucus, this may be worth considering. Now, there are lots of other alternatives as far as being able to try and treat allergies, and really it depends upon what your specific symptoms are. So there are some different prescription strength medications like Montelukast or Singulair, which work a bit differently. They work at the level of your antibodies rather than just focusing on drying up mucus. You can also utilize Mucinex, and the generic for that is guaifenesin. Now, interestingly enough, guaifenesin has actually been shown to help with chronic cough, chronic drainage, but it can also be a mucolytic, and so it can help to increase mucus production seen at the cervix. There is another over-the-counter supplement that you can purchase online, and it's called Transfer Factor. And this tends to work really well for people that have chronic allergies that don't want to be on antihistamines. Other supplements that have been found to have some potential benefit for allergies include probiotics, as well as the supplement Butterbur. Now, you may have heard me talk about Butterbur in the past, as it can also help with migraines, but we know that for some people it can help if you have seasonal allergies. Ideally, if you have particular symptoms in regards to your allergies, it's best to focus on treating whatever that specific allergy is. So for example, if your allergies typically manifest as puffy eyes or watery eyes, try and focus on localized treatments that would focus on just the eyes, so you can get different prescriptions or over-the-counter products that deal with allergies just of the eye. Similarly, it would be as if you have primarily nasal congestion or runny nose or itchy nose as your symptoms. There are different over-the-counter as well as prescription-strength nasal sprays that you can utilize to help prevent your allergy symptoms. This helps avoid those antihistamines used on a systemic level from taking a pill on a daily basis. I'd like to also talk a little bit about a few other supplements that we know that can cause some changes with your observations of cervical mucus. And one of those is vitamin C. Now, we all know of vitamin C as one of the main supplements that can help with prevention of catching the common cold or treating those type of symptoms, especially during the winter months. However, in some women, vitamin C can actually dry up their mucus observations. And so again, if you're taking this on a regular basis, that's just something to be aware of. There are also many other over-the-counter supplements that are marketed as fertility blends, and many of these will contain over-the-counter progesterone. And so when we talk about these fertility blends, a lot of them will have some of these products in them. So myo-inositol, wild yam extract, Vitex or chaste tree berry, coenzyme Q10. Now, independently, many of these supplements are ones that I recommend for my own patients, but it's in particular response to what's going on with their situation. The important point I want to make here is that many of these that are a fertility blend have multiple different things in them that may be helpful, but you may be duplicating and have more than what you need, or you may be getting something in these blends that actually is working against your system. For this reason, I typically recommend just individual supplements specifically for what you need, and ideally, this should be targeted towards your unique needs and your unique lab values while taking into consideration what you may already be getting in your diet so that we aren't having too much of a substance that you don't need or that could be doing harm. The last group that I want to talk about today is not necessarily over-the-counter medications or supplements, but really products that are easily available that I think people don't really realize can cause some significant harm. So this is going to include alcohol, tobacco, marijuana, and street drugs. And just because something is legal doesn't mean that it's safe, especially when things aren't regulated. So what we know specifically about alcohol, if you are consuming more than 10 to 14 drinks per week, if you are a male, this will decrease your testosterone levels. It will decrease your sperm counts. This is not a judgment on you and how much you drink. This is solely a numbers game. We also know that alcohol use in those quantities in women will decrease ovulation and decrease the chance of implantation. Similarly applies for tobacco use. We know that tobacco use in men will decrease their sperm counts as well as decrease the quality of their sperm. And in women, it will decrease their egg quality and decrease the frequency of having ovulation. Really, with these particular substances, my best advice is to just avoid them altogether. Now, if you're going to have alcohol, we say in moderation, right? So no more than 1 to 2 drinks per night, and ideally no more than 6 to 7 drinks per week. And again, as far as tobacco, marijuana, street drugs, the answer is just no. Just avoid those altogether. There is nothing good from a health standpoint that comes from these, especially when it comes to your menstrual cycles and your fertility. Imagine if you felt confident that what you are taking for over-the-counter products and what you are putting into your body is actually good for your menstrual cycles and your fertility, rather than potentially causing more harm. Make sure to tune into next week's episode where I share my favorite over-the-counter supplements that will actually help your menstrual cycle and improve fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa or Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.